Sure. So many years ago, I was involved with a meta-analysis. It was published in JAMA that really, for the first time, showed significant reduction in cardiovascular events associated with, in that case, influenza vaccine. The study meta-analyzed or combined several different randomized trials looking at flu vaccination versus no vaccination for influenza. Those trials were designed to look at influenza, but they did capture adverse cardiovascular events. And we pulled those adverse cardiovascular events and found a significant benefit of influenza vaccination. That was subsequently shown in a dedicated randomized clinical trial and subsequent meta-analyses to that. Incorporating that showed a very strong signal, in particular in patients at very high cardiovascular risk, such as patients with recent heart attacks, that sort of thing. And that opened the door to the possibility that maybe vaccinations more broadly, other than helping prevent the specific disease the vaccination is meant for, influenza, or in the case of what we're discussing, RSV, respiratory syncytial virus related issues, maybe there's an effect, a benefit even on cardiovascular or cardiopulmonary endpoints. So really now there's been a series of studies looking at not just influenza vaccination, as I mentioned, but RSV vaccination to see what the benefits might be, not just on RSV, that of course would be expected, but secondarily on cardiovascular and cardiopulmonary endpoints. And uh, beyond getting into the specific study that you wanted to discuss here, there are now randomized clinical trial data from the Danish group that has looked at RSV vaccination and indeed in the context of randomized trials shown a reduction in cardiopulmonary hospitalizations. But what uh, really is the more recent real world evidence that was produced in this study that you're asking about is looking sort of in real life in adults 60 years of age or older, what might the associated effect be of RSV vaccination, not in a randomized trial, but in an observational real world analysis. It's a terrific question. And I think there are really two layers to it. I think, first of all, preventing a bad infection can secondarily prevent bad things that happen from the infection. That is, we see this all the time, not just with RSV, but even I'll mention influenza, where someone comes in, and especially if they're vulnerable, as people over the age of 60 might be, because they may have underlying cardiac disease or underlying pulmonary disease or both. Those sorts of folks, a hospitalization for RSV or wasn't studied here, but from prior studies of influenza can really tip them over. So, they came in maybe not feeling great, but then the next thing you know, that acute illness, that acute infection then triggers, say, a heart attack. And that could be from two ways, as I mentioned. One could just be the stress of being sick, that is, having a fever, the heart rate's up, the person's dehydrated, maybe the blood pressure's a little lower than normal, and that combination can be a setup for blood clots, for heart attacks, most of which are caused by some degree of blood clots occurring where plaque is ruptured in the heart artery. So, the combination of other sorts of bad things that happen with a serious infection, in this case RSV, could then trigger a heart attack. So, that could be one pathway, I guess, maybe somewhat indirect, that is not specifically due to the pathogen, but just to being sick from the infection. That's, I think, pretty solid in terms of biological pathways. The other way is a little bit more speculative, that perhaps the infection itself is triggering inflammation that is triggering the heart attack. So that is also something, because there is evidence that inflammation can trigger heart attacks. And of course, infections have to provoke inflammation. That, to an extent, is a good thing. It can prevent an infection from just going completely out of control. But on the other hand, that adaptive response to the infection may be maladaptive when we're talking about inflammation, such as arterial inflammation, that may then provoke a heart attack or some other cardiovascular event. So there are potentially mechanisms by which the infection, other than just making someone generally sick, can lead to inflammation that can then trigger a variety of secondary sorts of problems, such as heart attack, but potentially even things like stroke or heart failure or exacerbations of lung disease like COPD. I think it's really important for people taking care of patients with cardiopulmonary diseases or at high risk for them, such as people, over the age of 60, to think about vaccinations. And that includes RSV, but I would also, mention influenza, for example, and just making sure that patients do have all their age appropriate vaccinations. And sometimes the exact ages depend on whether they do or don't have cardiovascular comorbidities. The American College of Cardiology recently put out a nice brochure reminding, in that case, cardiologists, but other healthcare professionals as well, to remember about vaccines. One, because it can prevent the actual illness the vaccine's meant for, but also in patients at high cardiovascular risk, that it might then prevent secondary complications such as heart attacks or strokes or flare ups of lung disease or heart failure. So, a variety of different cardiopulmonary conditions. So, even though historically we may not have thought of these sorts of vaccinations, such as for RSV or influenza, as being cardioprotective strategies, indeed it appears they are. I think that this is going to be an area of future investigation for other vaccines as well. There's observational data, for example, that a herpes zoster infection can be associated with an increase in cardiovascular events. So potentially, one might think even a strategy of vaccinating for shingles, beyond just reducing the risk of developing shingles, recurrent shingles, can potentially have cardiovascular benefits. This is something that would need to be studied in randomized clinical trials, of course. But certainly, there are emerging observational data supporting that there might be a connection there too. So, in general, probably the vaccinations people should be getting anyway, in particular older folks, other than just doing it for the sake of preventing the disease, may broadly have cardiovascular benefits. But again, a lot more research needed, for example, with the shingles vaccine. But for RSV and influenza vaccination, at this point, the data seem pretty compelling.